The Access in Medicine program welcomes you to learn about the role of faculty and administrators in the accommodation process. This module was created utilizing information from Chapter 4 of the book Equal Access for Students with Disabilities, the Guide for Health Science and Professional Education. This book and chapter were the primary resources for this video. We thank the authors Elisa Laird, Jan Sarantino, and J. Lee Cully for permission to use their important work. Faculty members play an important role in the student accommodation process. When a student shares their accommodation letter with faculty, faculty may find it helpful to connect with the student to discuss, in a confidential manner, how the accommodations can be implemented within the course. It is up to the student to decide if they would like to use their accommodations. Student wishes regarding whether and to what extent they use their accommodations need to be respected. If faculty have questions and/or concerns regarding the identified accommodations, they are encouraged to reach out to the disability resource provider for clarification. Accommodations are protected under the ADA, and faculty have an obligation to implement accommodations approved by the Disability Services Office. Should a non-standard accommodation be requested, faculty may be asked to participate in the interactive process to determine if the request is reasonable. Faculty should not decline an approved accommodation without connecting with the disability resource professional. As a good practice, if a student discloses a disability without documentation, the faculty member should refer the student to the Disability Services Office. All institutions should have an established procedure to provide student accommodations. As such, faculty cannot deny a student with approved accommodations the right to use them. As mentioned earlier, if an instructor has concerns about the approved accommodation, they should contact the disability resource provider for clarification. Institutions should have established procedures for faculty members who do not implement the accommodations in a student's letter. In addition, institutions should have procedures in place for instructors to raise concerns about approved accommodations and how the institution will address the instructor's concerns. Once an accommodation has been approved by the disability resource professional, the student does not have to ask for permission from the faculty to exercise the accommodation. The Office of Civil Rights has determined that the decision about whether an accommodation constitutes a fundamental alteration of the program cannot be left entirely with the faculty. As part of the interactive process, disability and curriculum experts must also be involved in the decision-making process. Therefore, a faculty member cannot make a unilateral decision to withhold an approved accommodation. All accommodation requests need to be reviewed individually. A blanket denial of accommodations is contrary to the university's duty to conduct an individualized inquiry for requested accommodations. Access is a shared responsibility. Both the disability office and the faculty must work together to ensure that the student is able to fully access the learning and training environments. The school or program should identify a confidential liaison or designated administrator who can help identify non-standard accommodations within the curriculum. Faculty should reach out to the disability resource professional if they have any questions or concerns related to the identified accommodations. Collaboration is key. The responsibility to ensure appropriate implementation of accommodations should not fall to the student, but should start with the disability resource professional. The accommodation process should be interactive and iterative, working with campus partners, such as technology offices, learning support specialists, curriculum committees, student affairs, parking, housing, dining, etc., is an essential part of the collaborative process. Students with disabilities may face multiple barriers, including physical barriers, attitudinal barriers, organizational barriers, communication barriers, etc. Regardless of the barrier, the disability resource professional should work with the student faculty, and other campus collaborators to ensure fully accessible learning and training environments. The disability resource professional should ensure that both on-campus and off-campus academic accommodations are implemented correctly. The disability resource professional should also advocate on behalf of the student, should concerns need to be elevated, and ensure that the rights of the students with disabilities are upheld by the institution. We hope this brief presentation has been helpful in outlining the role and responsibility of faculty in the accommodation process. For more information on this, as well as ways to implement accommodations in a variety of health science environments, please consult the Equal Access for Students with Disabilities Guide. These are the resources that were used to create this video. This video is a product of the Docs with Disabilities Initiative's Access in Medicine program in partnership with the University of Michigan Center for Disability Health and Wellness. The contents of this video were developed under a grant from the National Institute on Disability, Independent Living, and Rehabilitation Research, NIDILRR Grant number 90RTHF0005. NIDILRR is a center within the Administration for Community Living, Department of Health and Human Services. The contents of this video do not necessarily represent the policy of NIDILRR, Administration for Community Living, or Health and Human Services, and you should not assume endorsement by the federal government. This video is a product of the Docs with Disabilities Initiative and their Access in Medicine program. For additional resources and information about the Docs with Disabilities Initiative, please visit the Docs with Disabilities Initiative website or follow us on YouTube, Twitter, and Instagram.